Good morning. Sadly, I have to make a short medical video this morning in response to a video that's gone pretty viral over the last week, in which everyone's favorite little obnoxious dweeb, Ben Shapiro, did a hate segment about Cardi B's new single WAP, in which she exudes her sexual prowess. He had a big problem with this and did a whole segment about how terrible and inappropriate it is. And then subsequently, after he found he was trending, he decided to bring his wife, who is a physician, as I understand, a family medicine physician, in on the action, essentially saying that he consulted her, his so-called doctor wife, about this, and that her differential diagnosis for excessive arousal fluid production would be bacterial vaginosis, yeast infection, or trichomoniasis. And it's really sad. It's a very, very sad state of affairs because a family medicine physician, a third of whose training is in obstetrics and gynecology, should know very well that there is a massive distinction between the very normal process of sexual arousal fluid production during sexual arousal and these three diagnoses. So just very quickly, bacterial vaginosis, vulvovaginal candidiasis, otherwise known as a yeast infection, and trichomoniasis. Trichomoniasis is a sexually transmitted infection versus the other two aren't, although higher amounts of sexual activity can increase risk of bacterial vaginosis. All three will produce some vaginal discharge or vaginitis. You'll get some thin discharge in BV, some thin white discharge sometimes in candidiasis, and some scanty discharge in trick. Vulvovaginal candidiasis or yeast infection tends not to be malodorous versus bacterial vaginosis, and trichomoniasis do tend to be malodorous. And typically with BV, you won't have a significant amount of cervical irritation versus with trick. And with candidiasis, you get some redness, inflammation. Trick can cause the classic strawberry cervix. There are some other distinctions as well, and sometimes it's hard to distinguish, and all three will be empirically treated for. But I think it's a little concerning that a practicing family medicine physician is potentially out there unnecessarily prescribing antibiotic, antifungal, or antiparasitic medications for a very normal and healthy female experience, which requires no such treatment. So beyond the fact that this annoying dweeb made this video and brought his so-called doctor wife in on the action, it's a little sad that on top of that, he had to bring her in on the auspices of being a medical professional to sort of poke fun at this video, and not recognize that a woman having copious amounts of sexual arousal fluids produced by Bartholin's glands inside of the vaginal canal, very normal process. Also, some of the backlash to this video, of course, has been poking fun at Ben Shapiro. Haha, you don't get your wife aroused, and his wife is dry. Haha, that also shouldn't be shamed. He kind of brought it on himself, but it's perfectly normal and should not be taboo, or considered an inappropriate subject to talk about wetness or women who happen to have more or less arousal fluid production during arousal or during intercourse. Nor should we be poking fun at women who have issues with that, or relationships where there is lack of sexual chemistry, women who do have trouble producing those secretions, and sometimes lubrications have to be used. It can be psychological, sometimes couples therapy is needed. We should, we can have a sense of humor about this kind of stuff, but I just want to comment briefly as a medical professional as well. So I don't know what kind of medicine Ben Shapiro's doctor wife is practicing, but it's a little concerning. Finally, to step a little bit outside my role as a medical professional, I just wanted to say there was an implication brought up in Shapiro's rant about how the Cardi B video and song is anti-feminist. He sarcastically went on about how this is exactly what the feminists fought for. And I would say that confidence in sexuality and willingness to exude one's own sexuality as a woman is absolutely not contrary to feminism. It is not anti-feminist, and there's nothing to be poo-pooed or to be shamed. On the other hand, a little dweeb opining about how a proper lady should act and behave is very much contrary to the feminist movement. So again, very sad that I have to make a video like this. And whatever goes on behind closed doors at the Shapiro household, however dry it may be, and whatever religious conservative beliefs they have, none of my business. They're entitled to them. But when they go on and start imposing them on the general public, that's when I feel the need as a medical professional to step in and say my piece. Peace. Good day.